and I will be teaching cystic hygroma. So first of all, what is cystic hygroma? It is a cystic swelling due to sequestration of portion of jugular lymph sac from the lymphatic system during the development period in uterus. It is present at birth, and it may cause obstructed labor. Then in this, it is often associated with Turner syndrome, Klinefelter, and trisomy 18 and 13. It is also called hydroceal of the neck. In this, cyst will not communicate with the normal lymphatics, and so existing lymph will get absorbed, and the cyst will be filled with clear watery mucus derived from the endothelial lining of the cyst wall. It commonly extends into deeper planes across many anatomical planes and barriers. The cyst is multilocular. Um, Often extension may cross two or more lymphatic regions. Example, involvement of both neck and axilla. Then there is lymphangioma circumscripta. If it is circumscripta, it will be less than 5 centimeter, and if it will be diffuser, then it will be more than 5 centimeter. And lymphangioma ab acne, that is reticulate pattern. These are the different variants. So what is the site for the formation of cystic hygroma? Posterior triangle of neck, axilla, tongue, cheek, groin, mediastinum, and often multiple sites. What is the pathology? It contains aggregation of cysts looking like soap bubble. Cysts have mosaic appearance with larger cyst near the surface and smaller cyst in the deeper plane. Each cyst contains clear lymph with endothelial lining. Fluid does not coagulate. What are the clinical features? Swelling will be present at birth, and in the posterior triangle of neck, that will cause obstructed labor. The characteristics of swelling it will be smooth, soft, fluctuant, partially compressible, brilliantly transilluminant, not irreducible completely. During crying, the swelling often increases in size. Disfigurement of the face of the child is more worrying factor for the parents. Swelling, when it increases in size, it will cause respiratory obstruction, which is a danger sign. It may get infected, forming an abscess, which is tender, warm, soft swelling. It may cause septicemia, which may be life-threatening. Rupture with lymph ooze can occur. What is the treatment? First of all, we will aspiration of the content. Later, once the sac or capsule gets thickened by fibrous septa, it is excised. Then, care should be taken to have meticulous dissection across all planes, including deeper muscular one, to clear entire cyst wall. Otherwise, recurrence will occur. Third, when it causes respiratory obstruction, aspiration and tracheostomy is done, because we saw in the clinical features that when swelling increased in size, it caused respiratory obstruction, which was a danger sign. So, when it will cause respiratory obstruction, we will do aspiration and tracheostomy. Then, under proper antibiotic coverage, drainage of abscess is done. Later, sac is excised. Then, preoperative injection of sclerosants OK432 and PC-benil is recently used, and later, once fibrosis develops, excision of entire aggregation of cyst is done. What are the complications? It can cause respiratory distress, infection, infection, abscess, and septicemia. Then surgery itself may cause torrential hemorrhage, chylous fistula, chylous and recurrence of cyst 15%.